The climate crisis is underpinned by grave injustice. The countries most affected by the climate crisis are those least responsible for contributing to it. IPPF's vision is of a world where all people are free to make choices about their sexuality and well-being without discrimination. That vision is threatened by the climate crisis. The list of impacts of this intersection is devastatingly extensive. Limited access to services like contraception, safe abortion care, and STI testing and treatment. Reduced access to safe water during pregnancy and childbirth. Increased sexual and gender-based violence, and general neglect of the health and rights of people who typically face marginalisation. Our humanitarian action responds to the needs of women and girls in emergencies all around the globe. In April 2020, Tropical Cyclone Harold, a Category 5 cyclone, made landfall in Vanuatu before passing through Fiji and Tonga. IPPF's local member associations responded, reaching a total of 4,698 beneficiaries across the 3 countries with sexual and reproductive health care. Kiribati, a tiny atoll in the middle of the Pacific Ocean, is extremely vulnerable to the effects of the climate crisis. Humanitarian Youth Clubs, created by IPPF's member association, design disaster plans for the community, focusing on women and marginalized groups in emergencies. In March 2019, Cyclone Idai hit Mozambique, resulting in widespread destruction of houses, hospitals, schools, roads, electricity, and water sources. IPPF's member association was quick to respond with life-saving sexual and reproductive health care through mobile outreach to the displacement camps. A total of 9,983 beneficiaries were reached by a team of 42 volunteers and staff members. IPPF is placing human rights, gender equality, and the rights of women, girls, and marginalized groups impacted by the climate crisis at the center of our efforts to address the climate crisis. We are calling on governments and other external stakeholders to do the same. Sexual and reproductive health and rights should be recognized as an essential element of climate change adaptation and resilience. Sexual and reproductive health and rights are critical for advancing gender equality, health, and well-being, and for overcoming marginalization. They are critical for strengthening individuals' and communities' resilience and capacity to adapt to the climate crisis. There is no doubt that the climate crisis is one of the key challenges of our time. Our planet is in a state of emergency. The time to act for women and girls is now.